Hi, I'm Dr. Panay from Blue Halo Med Spa. Today we're going to be talking about PRP. It stands for platelet-rich plasma, which is a method of abstracting high concentrations of growth factors in stem cells that then we can use them in several different procedures in the medical field. It used to be done in the medical field for wound care. Orthopedics use it for joint enhancement of the tissue, and now we're using it cosmetically for several procedures in which we use the PRP, which is platelet-rich plasma that comes from the same patient. So we extract it from the patient, process it, extract the high concentration of growth factors in stem cells, and then apply to different areas of the body to enhance healing, to enhance the cosmetic results that we are reaching for. And it is used in several different procedures. So, which ones are the procedures that we use PRP for here at Blue Halo Med Spa? There are basically 4 procedures that we use it on. One will be the vampire facelift, the vampire facial, the O-shot, and the P-shot. So we will talk about all those 4 procedures one at a time, and I explain briefly what each one is. The first 2 that I'm going to talk about is the vampire facelift and the vampire facial. They're very related, and the terms are a little bit confusing, but they're a little bit different and they're done differently. The vampire facelift is actually taking PRP, extracted from the same patient, and then injecting it in the areas in the face mostly, where we mostly use it, although we can use it in other parts of the body, but using it in areas where we want to enhance. It's used almost as equivalent to using fillers, but instead of using artificial filler material, we're using PRP, which comes the platelet-rich plasma. It has growth factors and has stem cells that would enhance the results of the results. It can be done in combination with fillers in those cases in which we need to do enhancements or that needs fillers in some areas of the face. But the vampire facelift is usually using PRP, platelet-rich plasma, and injected in different areas where the person wants to enhance and get wrinkle reduction, texture improvement, and it gives a very natural look without looking artificially enhanced or changed in the terms of the procedure. We're going to talk about the vampire facial now. It is really using the same technique, using PRP, but instead we use the microneedling, which is tiny little microneedles that produce channels in your skin, and topically we apply the PRP and it penetrates through those channels, giving us the same results or enhanced results by penetrating through the skin, give us a better look and better results that way. The next procedure I'll be talking to you about is the P-shot. The P-shot is a procedure in which we inject a series of PRP injections into the shaft of the penis of the patient. That's why we call it the P-shot. It is done to enhance blood flow and restore the function of erection in patients who have that problem. That happens in males when we get old or because of certain diseases like diabetes or other conditions in which we lose the functionality of erection or the erectile dysfunction. By applying PRP on the shaft of the penis in a series of injections, it restores that functionality because PRP reestablishes blood flow circulation in that area and brings that functionality of erection to a normal state. Instead of doing it artificially with medication like Viagra or Cialis, this is more natural. It is long-lasting, so you would not need to have the need for medication in order to perform and get an erection when you have this condition, erectile dysfunction. So PRP is very effective. It's a natural way and has a long-lasting effect. The last and fourth procedure is called the O shot or the orgasm shot. It is an injection procedure too. It is using PRP in order to restore the tissue of the vagina and the area around the vagina where controls the urinary incontinence, which is one of the symptoms that many people have related to estrogen levels drop in the females. There are certain circumstances in which the female's estrogen comes down, whether it's medically for medical reasons or as their life expectancy after menopause where the estrogen naturally comes down. Those conditions in the females produce dryness of the mucosa. They don't have that much normal secretions. They have painful intercourse and dryness, and then mainly also urinary incontinence, which is a related symptoms that many of these females have. All of those can be corrected by the use of PRP. PRP, or platelet-rich plasma, by being injected into the area, restores the tissue, restores the lubrication, restores the functionality of that tissue, making it less painful when having sex, or has a lot of lubrication, which is, take care of the dryness, and then takes care of the urinary incontinence very effectively. It's a very simple procedure, a one-time deal, and restores all that. The results are amazing. We do have some testimonials that we would like to present to you of people who have had it and give you the experience and the results.